Hi, I am Dr. Sandeep Day. I'm a senior consultant in the Department of Radiation Oncology in Apollo Hospitals, Navi, Mumbai. There are so many myths surrounding the treatment of radiation therapy. In our daily consultation, people do come across with so many questions. So, my today's talk would involve trying to dispel the common myths in the field of radiation therapy, or we say radiation oncology. The very first myth is radiation can cause the cancer to spread. Now, this is absolutely wrong. There are three scientifically established modalities of treatment in oncology. Oncology is the study of cancer. The first thing is surgery. We all know about it, and the doctor who is expert in the surgical field is known as a surgical oncologist. Then there are treatments like chemotherapy, immunotherapy, hormonal therapy, or even targeted therapy, which are injections sometimes given through the IV fluid or even orally. These are managed by an expert called a medical oncologist. And the third part is radiation therapy. And the expert who deals with this kind of treatment is known as a radiation oncologist. So these are the three main scientifically proven modalities of treatment in oncology. So radiation is used to treat a cancer. So what an element which is used to treat a cancer can never cause the cancer to spread. So this is an absolute myth. There is no truth in this sentence. Now, if you look at the kind of treatment, very few cancers in the body can be treated with a single modality. In the current era, it's a multi-modality treatment. So almost all the three modalities of treatment are used in various permutation and combinations and in various sequencing to cure a cancer. So if you look at any cancer in a life frame of a person, radiation therapy would be used in almost 65 to 70% of cancer patients in some part of his or her life. So there lies the importance of radiation therapy. Now, when you talk about a cancer therapy, I will just like to mention there are two broad specialities or kind of treatment. The first is known as a radical treatment. As the word radical signifies, it's a curative intent. So we are trying to cure. Our intent is to try to cure the patient. So there we use the term as definitive therapy. As for example, treating airway or laryngeal cancer or the food pipe or pharyngeal cancer with chemoradiation therapy is called a definitive chemoradiation therapy. Or even treating a cervical cancer. Cervix is the part or the lower part of the uterus. Treating it with chemotherapy and radiation therapy is again known as a definitive chemoradiation therapy. Again, in head and neck cancer or in breast cancer, when radiation therapy is used after a surgical intervention or after a surgery, it is called as an adjuvant treatment or adjuvant radiation therapy. So both form a part of a radical treatment where the intent is curative. On the other hand, in case of advanced disease or when there is a metastasis, the word metastasis means the primary tumor from some part of the body has spread to other organs, as for example, a brain metastasis or a painful bone metastasis or spinal cord compression. So in all these things, we use radiation therapy for with the intent of palliation. The word palliation or palliate means to get relief from the symptoms. So we use a smaller dose of radiation in those settings, and the treatment is definitely not curative. It is basically symptom relief. The second myth is radiation therapy painful? The delivery of radiation therapy is absolutely painless procedure. So currently in most of the centers, we use a machine called linear accelerators. So that emanate something called as photons. Photons mean packets of energy. And in the previous days, we used to use machines called as telecobalt machines, They're also used nowadays in remote corners. So these telecobalt machines have a telecobalt source, and that gives rise to gamma rays. So these are basically kind of can be equated with X-rays, Uh, Almost all of us have undergone chest X-ray in some part of our life. So X-ray is absolutely painless process. We don't even realize when the X-ray happens. So this kind of radiations, either it be a photon or be a gamma rays, can be equated with X-rays. So the delivery of radiation therapy is absolutely painless procedure. You don't even realize when the treatment is being delivered. Having said that, yeah, radiation therapy does give rise to side effects. As for example, in when you're treating a head and neck cancer, it usually is around 6 to 7 weeks duration treatment, divided over many fractions, delivered weekly, 5 days a week, that is Monday through Friday. So around the first couple of weeks or first 3 weeks are relatively unremarkable, you don't realize anything. Around from the third week onwards, you have a little bit of discomfort in the head and neck area, you can have a little bit of difficulty in swallowing, you can have a little bit of sore throat. So towards the end of the treatment, you can complain of some amount of pain in the head and neck area. But when we treat cancers of the breast, the lung, the abdomen, we don't usually come across the pain sensation. They're relatively smooth. Now, if you look at a patients who were treated previously, many years back, when the technology was not that refined, people used to have much more side effects. Pain, ulceration, sore throat, everything. And these are all called acute radiation side effects. That means they happen during the time of radiation. And we give medications. With the help of medications, they're usually taken care of. And there are temporary side effects. Once the radiation treatment is over, say within around 6 to 8 weeks duration, all the side effects tend to come down to almost the baseline. And we used to have quite a few long-term side effects known as lead side effects, like the acute dryness of mouth because the parotid glands were affected and the saliva secretions were less or sometimes nil almost. Then we used to have a difficulty in swallowing called dysphagia because the swallowing muscle or called the pharyngeal constrictor muscles were damaged. And these are usually lead side effects developing say 6 months to 2 years after the completion of radiation therapy. Now with the modern methods of radiation therapy, the chances of this kind of lead side effects developing have become almost a rare entity. So there are various modern techniques of radiation planning called IMRT, then image guided radiation therapy, otherwise known as IGRT. There is volumetric arc therapy or rapid arc called VMAT. Then we have SBRT, stereotactic body radiation therapy, stereotactic radiosurgery. All these are very modern techniques of radiation therapy. So definitely discussing all these things are not in the realm of this talk. When you meet your radiation oncologist, definitely he or she will be able to make you understand about the significance of these techniques. The third myth is, does radiation make a person radioactive? Again, absolutely, there is no truth in that. Be it external beam radiation therapy or internal radiation therapy, which we call brachytherapy, doesn't make a person radioactive at all. Once you come out of the radiation bunker or the radiation room, you are absolutely free to mingle with any of your family members, relatives, even pregnant women, children. So there is absolutely no harm to any of your family members when you are undergoing radiation treatment. The fourth myth is radiation causes hair loss. There is some truth to that, but no absolute truth. As I said, radiation is a local therapy, just like a surgery. Unlike chemotherapy, which is given through IV fluids and it circulates in the circulatory system, and the side effects of chemotherapy are usually systemic. Contrary to the fact, radiation being a local therapy, the side effects will be purely local. So, a lot of people, a lot of women undergoing breast radiation therapy ask us whether I'll be having hair loss or not. So, absolutely no. The effect of the radiation therapy will be pertaining to the breast area only. So, having said that, treatment of the brain, definitely a patient having treatment of the brain would have some kind of hair fall. Even when we treat male with the head and neck cancer, there will be a hair fall of the beard or the mustache, but that's all. So a patient who is undergoing radiation to the chest or the abdomen won't have any hair fall or hair loss in the head. The next myth is radiation causes nausea and vomiting. Again, there is a partial truth to that. As I said, radiation therapy is a local therapy. So, treating a head and neck cancer probably won't cause any nausea or vomiting, but it's usually seen that when we combine chemotherapy with radiation for head and neck cancer, patients do have some amount of nausea, and that's because we have added the chemotherapy part to it. But when we treat patients in the stomach area or the lower part of the stomach or the pelvic area, there is definitely some kind of nauseating sensation, but vomiting per se doesn't happen, and these are taken care by medications. The next myth is that radiation produces mutation in the cell, and that can be transferred to the next generation or to our children. Again, there is absolutely no truth to that. Yes, radiation produces the DNA damage in the cancer cell, and a mutation happens. So when the mutation happens and the cell tries to divide, it dies a reproductive cell death. This is the mechanism of cell kill in radiation oncology. But this kind of changes are called somatic changes, and they are non-inherited. So absolutely there is no risk of the next generation or children from this kind of radiation to incur any kind of genetic changes. But having said that, treating a lady who is pregnant is definitely a very challenging job. So there are chances of the fetus getting damaged. So if there is an emergency, in case of treating a pregnant lady, we need to weigh the risk-benefit ratio. And if at all radiation needs to be given to such a lady, we need to use modern techniques and special techniques to see that the radiation doesn't reach the fetus and the fetus is kept as safe as possible. Thank you so much.